All right, let's run through everything related to impulse control disorders, starting with our basic diagnostic criteria. An impulse control disorder is characterized by a repeated inability to resist an urge, to carry out some kind of behavior that is rewarding in the short term in some way, but has long-term negative consequences. As with almost any disorder, it needs to cause significant impairment. It needs to cause significant impairment to, I use rows just to remember, there's other ones. Sometimes they have family life, relationships, occupation, social life, education, just specifically, because if it's not causing you significant impairment, like take my hair, my playing with the back of my hair. I am repeatedly unable to resist the urge. That's true. It is rewarding for some reason. It scratches an itch in my brain. It does have long-term consequences. My hair is cut off back there, but it is not significantly impairing my life. So there's your threshold. The ones that you need to know are specifically mentioned in the ACE syllabus by name are these three. Remind yourself, please, of those things. I'm not going to say anything about them. There are other ICDs that are named in the ICD-10. There's the ones, so you can take a look at it. Like I said, trichotillomania is named, and then they have, just like they have other specific phobia, they also have other habit and impulse disorders. So this is kind of a catch-all. So if you, for example, if you have compulsive buying, you would be categorized or diagnosed with other disorder, but according to the ICD. All of them are characterized by, you feel an intense feeling of tension or affective means emotional. You feel that physiological tension or that emotional arousal before you perform the behavior. And then the reason you perform the behavior is to get that relief, excitement, or gratification of that tension. So that's why imaginal desensitization as a therapy is designed around removing that feeling of tension. By removing that, you remove the person's need to do the behavior. The CASAS is named in the standard, so you need to know these things about it. I'll let you quickly take a look at it. Here is the one I could find that wasn't behind a paywall. Remember that this is asking about in the past week, and then I would just memorize one of the items from it. But that is the CASAS. I want you to consider these things real quickly, and I'm going to ask you a question about them. And then let's get into our explanations. So we have three explanations here. One of them is biochemical, and then we've got two psychological ones. Notice that behavioral, sometimes they will break behavioral out in its own category. Sometimes they will put it under psychological, but they will be quite clear with you, remember, when you write your describe essay as to which one they want you to do. So if they say behavioral, they're specifically talking about positive reinforcement. But biologically, what we have going on is that participants perform that impulsive behavior because it activates the reward system, the striatum. There's also the nucleus accumbens. I'm going to pull up the thing for you. I thought I had a visual, but it's not right here. So if you go with the striatum, you'll be fine. That releases dopamine, and that's what causes them to feel that euphoric rush. But the more you do the impulsive behavior, the less dopamine you get released each time. This is related to the concept of drug tolerance. You develop a tolerance to a drug, and then you get less of a high each time you do it. Similar thing is happening here. The more times the kleptomaniac steals, the less dopamine they get each time. That's called dopamine or reward deficiency syndrome. The amount released decreases each time. Thus, sometimes the patient will increase the intensity or the frequency in order to experience the rush. This is analogously why drug addicts may originally take a hit and then 8 hours they're good, but as they start to develop that tolerance, they take a hit and then they're out looking for a drug again almost immediately to try to get that high. Some participants who take synthetic dopamine, one of the reasons we know that the dopamine is implicated here is that some patients who have Parkinson's who have to take synthetic dopamine as a treatment for their Parkinson's, if the dosage is too high or off, they sometimes start to do things like impulsive gambling or compulsive compulsive shopping. So that's some evidence for the dopamine deficiency syndrome or the biological explanation. Next up, we have our first psychological explanation, which is specifically our behavioral explanation. A behavioral explanation is always related to positive or negative reinforcement or to classical conditioning in the case of phobias. But the idea here is that the impulsive behavior was learned by operant conditioning. So if classical conditioning is learning by association, the way people do with phobias, operant conditioning is learning by consequences. So each time that they got, in this case, obviously consequence is neutral. It's just something that happens as a result of something else. In our case, we're talking about rewards, obviously positive reinforcement. So the example for this that's easiest to understand is in pathological gambling. Each time I play and I get a reward for playing, that behavior of playing is reinforced. And it might seem paradoxical, but this is even more effective when you only get partial positive reinforcement. If I get the win, the coins each time, then I might be like, oh, well, I know they're there. But if I get the coins one time and that's part of what gets me hooked, and then I try again and I don't get it, so then I'm like, oh, I got to keep doing it. So it actually increases it even more because I never know when I might get that reward. So I continue to chase that win. So that's our behavioral explanation. For a kleptomaniac, they walk into a store and they feel that sense of tension. They feel that affective arousal start to kick up. So they start looking around for something to steal. They may not be able to steal on any given occasion because, say the employee comes by at the wrong time, so they don't steal in that case. So they're only getting that reward of that item and that's like a tangible reward. We're not talking about the dopamine rush, because that would be part of the biochemical explanation, or the biological biochemical explanation. But if I'm only able to steal an item every few times, then the rush, the excitement of it doesn't wear off, and so I am wanting to do it again and again. So just to give you, because sometimes people ask for another example of this. So I only get that item. Now remember, a crucial point of kleptomaniacs in particular is that they steal things they do not need. They are stealing even when, just like people are lighting fires without motive, they're stealing without motive, all of those. They are doing this thing without motive. And that tragic story of Glover, yeah, she was the one, Glover, the Glover study, the woman in the Glover study, she stole baby clothes and she didn't have kids. Like, they steal things they do not need and often give them away or throw them away because it's really not about the clothes is the point. It's about the feeling that they get beforehand. Then we've got our cognitive explanation, which is the feeling state theory. One thing that many of you did not include that I think is probably what they're looking for, and they did ask about this last year, is a true definition of the feeling state. So to Miller, the feeling state is all of the emotions, that's the feeling part, but also the thoughts, the cognitions, the physiological sensations. All of that is what's related to the particular behavior. So when a participant when somebody who had a feeling state, so let's say someone who one time they gambled and they won big, and that amazing sensation, though, of feeling like a winner, and they had always felt like a loser in their life. So they felt like a winner once. And then like that feeling like a winner becomes rigidly linked to the behavior of gambling. And the only time that they're ever, in their mind, the only time they're ever going to be able to get back to and feel like a winner is going to be when they are gambling. But it's also those thoughts that they have. It's the physiological sensation. So it also includes the heart racing. It also includes the warmth and the excitement. All of that is also part of that feeling state. So once that rigid link happens and they have that state dependent memory, now they're going to keep doing that behavior because they think it's the only way they can recapture it. We'll look at a couple of examples just to remind you. So for Don, what Don really wanted was, he had an intense experience of approval. So what Don really wanted is approval. Don doesn't have sex with the women so he can impregnate them. He doesn't have sex with them because he's even particularly attracted to them. The only reason he's doing it is because he wants approval. So that is the feeling that he is trying to recapture, and he associates that only with a conquest of women. I used this example already, but Tim, on the other hand, what Tim had always wanted was to feel connected to his dad. And he finally, right when he was in college, he got to play, and he got to play with his dad. And at that point, he was like bonded. So for him, he continues to play poker because that gives him that feeling of connection with his dad that's always been missing in his life. Now, our treatments. I'll talk a little bit about opiate antagonists and Grant very briefly because I have a whole Edpuzzle about that. But first, we're going to talk about our psychological treatments. As a reminder, they have a lot in common, which is what makes them so hard. But sensitization is adding a feeling. Desensitization is taking a feeling away. But in both cases, they are going to start with muscle relaxation techniques, not muscle relaxants, that's a drug, but muscle relaxation techniques for two reasons. One of them is both of these treatments involve you needing to do a lot of imagining, not just covert, but also imaginal. So the goal of that relaxation is that you are more likely to be able to immerse yourself deeply in that visualization. In order for it to work, you need to be deeply immersed in it. And the muscle relaxation techniques help with that. But also the muscle relaxation techniques help with the imaginal desensitization because they're like central to it, because remember, the one of the defining features of an impulse control disorder is that affective arousal or tension that you feel before doing it. So a huge part of imaginal desensitization is maintaining that feeling of calm in the face of your triggers, in the face of the scenes, all of the specific moments when you might otherwise be taking part in this. But the mechanism by which they work is different, but another thing they have in common is that often the instructions that the therapist gives will be recorded and you will need to practice it at home. So if we start with covert sensitization, this is sort of based on classical conditioning. They want you to associate that impulsive behavior with an unpleasant stimulus. And most commonly, you read a bunch of case studies of this, but most commonly that's going to be nausea or something else, some aversive stimulus. An aversive stimulus is something that you want to avoid, that in this context, it is something you want to avoid that makes you less likely to do the behavior. That is the point. So the example study here is the Glover study. I would love to be able to tell you more about this woman in this study. It's just an example study, so you don't need to know a lot. I'd love to be able to tell you more. The full study, though, is behind a paywall. So I've already paid to get key studies. I'm not going to pay to get this. And you don't need it. Like, this is the information that's in the textbook. They have a little more info. The textbook has a little more info than is publicly available in the abstract, so somebody must have paid for it. But you don't need to know a huge amount. You need to know this woman is 56 years old. She had been shoplifting for 14 years, nearly every single day. And the way that she was treated was Glover created that association between shoplifting and nausea or vomiting, because that was your aversive stimulus. Just to remind you how this works. Now, the covert sensitization, one strength of it is that it can work quite quickly. You can be treated in as little as 4 sessions. The first 2 sessions for Glover specifically, it started with that muscle relaxation, helping her get immersed in the visualization and instructing her to imagine vomiting when she picked up the item. So she would imagine herself going into the store, picking up the item, and she would start to vomit. And she would imagine everyone around her being disgusted and being like horrified by her and grossed out. And then in her final session, she imagined the same thing, but she imagined she put the item down and didn't steal it, and then the nausea went away. This is a big part of what you left out in your essay. What people often forget is a key point of it. It's not just like, oh, I feel nauseous when I steal, but I stop feeling nauseous when I put that item down and don't steal. Glover tells us that at the 19-month follow-up, she had only one lapse. One time when she had stolen one, and she reported improvement in her self-esteem and improvement in her socialization. So that's your covert sensitization. It is worth keeping in mind that this does nothing about the underlying causes for her stealing. They did not delve into, because feeling state therapy, which you don't which we don't learn about. Feeling state therapy involves, okay, let's go back and figure out what is the feeling you've linked with stealing. Let's recapture it and figure out what exactly is wrong with you. And then let's address that. It doesn't change the thoughts about stealing that she has. It just creates this association between stealing and nausea. And that's the method by which it works. Imaginal desensitization. Again, step 1, you're going to teach them the muscle relaxation technique. Step 2, they're going to visualize themselves being exposed to the trigger. Now, I used Blazinski and Knower is the example study. You don't have to remember their names. It's not required for you on the essay, but in particular, they cite as an example the Blazinski and Knower study, which is about Mary. That's probably not her real name, but Mary the gambler. And for Mary, remember that they had Mary. Let me open that piece. So one of the first steps was to, as you can see there in handout 1, identify the situations that trigger Mary's desire to do her impulsive behavior. So what is the situation? Because we're going to come up with, we're going to have not just one set of scenes, but say 3 sets of scenes starting with the trigger. So we talked about this one as an example. This was one of the things that triggered Mary to want to gamble. And then not only are we going to come up with the trigger, but also what are those feelings? What are we thinking? So imaginal desensitization is a little bit more holistic in the sense that it's actually looking at those causes. It's looking at those triggers. It's not just pairing the behavior with something negative to discourage you from doing it. Remember that a big part of this is that all the way throughout, you need to be, the whole time through the imagining sequences, you need to be staying calm. Here's the script for progressive muscle relaxation, because again, the whole point is desensitization. So we're not just removing the tension in the beginning, we are removing the tension all the way throughout. We are remaining calm. Then of course, like we said about doing it for homework, I'm going to have you pause it so you can reread this, because then you can remember a little more detail about how imaginal desensitization works. But this is one set of Mary's scenes, starting with, this is kind of, oh, I apologize. This is not Mary's specific scenes. This is a general, the scenes that you would go through. So whatever the trigger is that initiates the urge, and then you don't just jump from, oh, I'm in the office feeling lonely, and then I'm at the casino. You're supposed to imagine the entire set, the entire process by which you get there. And again, let's not forget about probably the most important part is the having second thoughts about the behavior. I don't want to say a huge amount about opiate antagonists in Grant because there's a whole other video on it, but real quickly, I would show you the abstract and remind you and clarify a couple of things. Remember that this is a compilation of 2 separate studies that were actually run. Between the 2 studies, there were 284 subjects. There was one group that was taking nalmefene and for 16 weeks, and one group that was taking naltrexone for 18 weeks. And in both of those separate studies, there was also a placebo group. We know that overall, about 75% of participants were taking one or the other drug, and then about 25% of total participants were taking a placebo. So they just ended up, because the results were the same, they decided to combine them and present them together. And that's what this paper does, is present the combined results of 2 separate drug trials. Quickly, I'll say opiate antagonists work by blocking opioid receptors in the brain. This sentence from the discussion is pretty helpful. Although multiple medications appear efficacious in treating PG, prior studies did not systematically investigate which clinical factors are associated with it. So there's been a lot of trials, a lot of different drugs, but no study has focused specifically on which factors predict that you will have a positive outcome. Remember that impulse control disorders get worse over time. That's why that may be why younger people responded well to the placebo. He hypothesizes that's why younger people had a positive response to a placebo that doesn't actually have an effect because their learned behaviors are less ingrained. So the whole point of this grant study was to see what those factors might be, those clinical variables that would predict you would have a positive outcome. Because the quicker we can get you on the right drug, the less ingrained your disorder will become. And they found that a family history of alcoholism was the significant predictor of a positive response. And they say, so if we're able to better understand those biological factors, we might, through like neuroimaging of your brain or genetic data, then we can get access to even more information that'll help us understand whether you're going to respond to and who responds to to opiate antagonists for pathological gambling. I'm going to give you a chance to reread this, pause and reread this, and I'll ask you a question. And then pause and reread these, the last 2 paragraphs, and I'll ask you a couple questions. And hopefully that helped, a quick review of impulse control disorders.